David Freeman cycles to keep fit, even though his doctors have told him he has just a few weeks to live. David isn't prepared to accept this, but he's been denied treatment that might prolong his life even if it can't cure him.
I think I'm fighting cancer on my own. Now I'm fighting the NHS to get the treatment which surely I deserve, you know. I've worked most of my life, retired about 2 years ago. So you think, well, if you've paid in, surely you get some sort of treatment, but no.
Socialized medicine is the provision of medical and hospital care for all by means of public funds. The beginnings of socialized medicine is located in Europe, where it started out as a compulsory sickness insurance in Germany in 1883 and mutual benefit societies in Switzerland and other countries. These programs eventually became universal due to the need of income stabilization and growing medical expenses in Europe. Today, there are many developed nations around the world that have socialized medicine, such as Sweden, Japan, and Canada. The United States does not have socialized medicine. Due to the Affordable Care Act signed by President Obama on March 23, 2010, American citizens are provided with affordable health care insurance. Obamacare is not socialized medicine because it only provides insurance instead of providing all aspects of healthcare through taxes.
I believe that Americans should not be entitled to socialized medicine because it will raise the debt and deficit of the United States and the quality of healthcare will deteriorate.
If socialized medicine was implemented in the United States, the federal government would have to spend more money on healthcare. The actual growth rate of healthcare spending has already surpassed the government's projection of it. There has also been a 13% increase on federal spending for healthcare of the gross domestic product. This increase takes away federal spending from Social Security, defense, and other federal programs. Paul Ryan, the chairman of the House of Representatives Budget Committee, has also expressed his concern in the debt of the United States rising if a government-controlled healthcare program is implemented. Socialized medicine in the United States would also lead to higher taxes, which would result in more people going into debt. Because healthcare spending keeps rising, taxes in America could eventually rise to Swedish levels. The quality of healthcare would deteriorate if socialized medicine is implemented in the United States. Patients need a physician to properly diagnose their symptoms, and if the physician demand rate is projected to grow by 17% in the next 15 years, there will be too many patients for the physicians to care for in the United States. The population growth rate will surpass the amount of physicians there are currently because of the process of becoming a physician can take at least 10 years. Without a proper number of physicians to support the growing population, there will not be enough medically intellectual individuals to care for the population. Large amounts of money are being spent on an entire population with socialized medicine, which will eventually result in selective healthcare. Bruce Hardy, a man living in England with kidney cancer, was denied the purchase of an expensive drug to prolong his life. British authorities refused to purchase the drug because they decided that Hardy's life was not worth extending. England does not have enough money to save everyone, so it had to choose which ones to save. If Hardy had lived in a country without socialized medicine, he would have been able to purchase the drug to prolong his life.